Hello everybody, this is Juliet again from Prega News, and today I'm here with a new topic, that is labor during pregnancy. Before we start with this, we should know what is labor time. There are 3 signs that could herald the onset of labor. This may appear by themselves or 2 may even appear together approximately 15 days before the expected date of delivery or after. So let's check out in detail how labor is during pregnancy. As the birth approaches, a woman's body begins to prepare for the labor. Signs that women may experience prior to labor include show pink mucous discharge from the vagina, engagement of the baby's head more frequently, that is known as Braxton Hicks contraction, a change in baby's movements as they run out of space, weight loss of up to 1 kg, low pelvic pressure due to baby's position, some diarrhea and nesting behavior. Once conditions are right, labor will commence. The hormone Oxytocin is responsible for the strong regular contraction of labor. Oxytocin release is triggered by a center in the brain and it causes the uterus to contract. What are the stages of labor and birth? The process of labor and birth is divided into 3 stages. The first stage begins when you start having contraction that cause progressive changes in your cervix and ends when your cervix is fully dilated. This stage is divided into 2 phases: early labor and active labor. During early labor, your cervix gradually effaces, that is thins out, and dilates, that is open. Active labor. During active labor, your cervix begins to dilate more rapidly and contractions are longer, stronger and closer together. People often refer to the last part of active labor as transition. The second stage of labor begins when you are fully dilated and ends with the birth of your baby. This is sometimes referred to as the pushing stage. Next, the third stage begins right after the birth of your baby and ends with the delivery of the placenta. Every pregnancy is different, and there's wide variation in the length of labor. For first-time moms, labor often takes between 10 to 20 hours. For some women, though, it lasts much longer, while for others, it's over much sooner. Labor generally progresses more quickly for women who have already given birth vaginally. Now here we will discuss 3 of the stages. First stage is early labor. Once your contractions are coming at relatively regular intervals and your cervix begins to progressively dilate and efface, that is thins out, you are officially in labor. But unless your labor starts suddenly and you go from no contraction to very frequent and regular contraction right away, it can be tricky to determine exactly when true labor starts. That's because early labor contractions are sometimes hard to distinguish from the efficient Braxton Hicks contraction that may come right before, contributing to so-called false labor. Early labor phase, the time of the onset of labor until the cervix is dilated to 3 cm. During this phase, you should just try to relax. It is not necessary to rush to the hospital or birth center. Try to enjoy the comfort of the familiar surroundings at home. If early labor occurs during the day, so do some simple routines around the house. Keep yourself occupied while conserving your energy. Drink plenty of water and eat small snacks. Keep track of the time of your contraction. If early labor begins during the night, it is a good idea to try to get some sleep. If you are unable to fall asleep, focus on doing some light activities like cleaning out your closet, packing bag, or anything you feel like. Small things, making sack lunches for the next day, whatever. Now, what to expect? Early labor will last approximately 8 to 12 hours. Your cervix will efface and dilate to 3 cm. Contractions will last about 30 to 45 seconds, giving you 5 to 30 minutes of rest between contractions. Contractions are typically mild and somewhat irregular, but become progressive, stronger, and more frequent. Contraction can feel like aching in your lower back, menstrual cramps, and pressure or tightening in the pelvic area. Here in this particular picture, you can check out how things happen during early labor. Like it is closed, that is 0 centimeter. Gradually it gets dilated to 2 centimeter and then to 4 centimeter. This is the way the head is about to come out from your vagina. This particular picture shows you the dilation stage. You can see your water might break. This is known as amniotic sac rupture and can happen anytime within the first stage of labor. Active labor phase. Dilation is here in this picture. You can see the dilation stage. That is, dilation is the opening of your cervix. Your cervix open from 0 centimeter to 10 centimeter when it is fully dilated. So many times doctor will come up and they will have a checkup that how much is dilation. According to that, they will decide when you are supposed to go to the labor room. So now the question arises in our mind is what to do. Now is time for you to head to the hospital or birth center. Your contractions will be stronger, longer, and closer together. It is very important that you have plenty of support. It is also a good time to start your breathing techniques and try to few relaxation exercises between contractions. You should switch positions often during this time. You might want to try walking and taking a warm bath. Continue to drink plenty of water and urinate periodically. What to expect now? Active labor will last about 3 to 5 hours. Your cervix will dilate from 4 centimeter to 7 centimeter. Contraction during this phase will last about 45 to 60 seconds with 3 to 5 minutes rest in between. Contraction will feel stronger and longer. This is usually the time to head to the hospital or birth center. Transition phase. What to do during transition phase? During this phase, the mother will rely heavily on her support person. This is the most challenging phase, but it is also the shortest. Try to think one contraction at a time. This may be hard to do if the contractions are very close together. Remember how far you have already come, and when you feel an urge to push, tell your healthcare provider. What to expect during this phase? This stage is generally known as placental stage because this is the delivery of placenta. This is the stage when the delivery of placenta occurs. Transition will last about 30 minutes to 2 hours. Your cervix will dilate from 8 cm to 10 cm. Contraction during this phase will last about 60 to 90 seconds with a 30 second to 2 minute rest in between. Contractions are long, strong, intense and can overlap. This is the hardest phase but also the shortest. You might experience hot flashes, chills, nausea, vomiting or gas. Don't get scared of anything, just have faith on yourself. What can I do to help myself through labor? This is the best question one should know before entering to the labor room. Informing yourself of your many options is really helpful. You can do this by reading, attending prenatal classes, speaking to others. One of the main things that research has found helpful is the presence of continuous support person. This person may be your partner, friend, relative or an experienced labor support person. It is important to feel comfortable in the environment you have chosen to give birth. You can make a labor room more comfortable by turning down the lights, closing the door, bringing some personal item and moving the furniture to suit yourself. It is important to avoid dehydration in labor by drinking regularly. Eating small, light snacks in early labor is also helpful. Use upright position as this helps stimulate the labor process and it is much easier to get comfortable. How long early labor lasts? It can be difficult to tell exactly when early labor starts. It's often not easy to say how long this phase typically lasts, or even after the fact how long it lasted for a particular woman. The length of early labor is quite variable and depends in large part of how ripe or dilated and effaceted your cervix is at the beginning of labor and how frequently and strong your contractions are. With a first baby, if your cervix isn't effaceted or dilated to begin with, this phase may take 6 to 12 hours, although it can be significantly longer or shorter. If your cervix is already very ripe or this isn't your first baby, it's likely to go much more quickly. Hope this channel of mine, that is Prega News, is helping you out to learn a lot of things about pregnancy, and especially in this video, hope all the ladies have got mentally prepared for their labor and they would have exactly come to know how labor happens and what is labor during pregnancy. So thank you for watching my video. Please do not forget to subscribe, share and like my channel, that is Prega News. Please do not forget to click on the bell icon to get the updated notifications. Thank you.